Another child died in a dental office, Athana Rodriguez Araga. She was 4 years old for a tongue tie. In 2012, there was an ABC News and Nightline report on pediatric dental sedation that called attention to the world to what was going on in pediatric dentistry, where oral conscious sedations, where the dentist gives a mixture of intense cocktails, opiates, benzodiazepines, other drugs, and nitrous oxide, and local anesthetic, was often ending up with children going pretty wild, uncontrolled for a long time, to accomplish the prescribed dental treatment: crowns, fillings, extractions for cavities, for the most common disease in the world. I'll never forget that, first of all because I was in pediatric dental residency at the time, but most of all because my best friend tagged me in a Facebook post, where Facebook was just becoming really big, and said, I know Jeremy would never do this. And I was just finishing a break, at the end of which I was going to go do my second ever oral conscious sedation. Not coincidentally using the exact same drug cocktail that killed Athana. And I thought about it the whole time. I was a second year resident, and I was helping a third year resident, and he was a beautiful storyteller, and he would enwrap the child's mind to get them comfortable, to lead them through their trip, through their psychedelic trip, to try to enable them to get the treatment done. And as 1/3 of oral conscious sedations do, the child was okay at first, and then went completely nuts and was screaming and sort of fighting to be free, and was getting the dental treatment done. And as part of my residency, I went on to participate in 100 more. And but that day, it really hit me that this is an insufficient solution to the world's most common problem in terms of medicine, in terms of health. And it was a challenge to me, to our field that day 14 years ago, to make a better solution where children didn't need to be sedated so often. We've seen numbers that in most states about 1 in 50 children who's on Medicaid ends up getting oral conscious sedation, and about 1 in 14 of them have adverse outcomes. Not long term, but not pleasant either. Kid's in pain, kid goes wild, parent doesn't know what to do, and sometimes these children die. It's rare. Our field of pediatric dentistry has done a massive amount of work to try to make sure that no children have adverse outcomes or die, by being very specific about the dosages that are given to children and not redosing and doing all sorts of things. And for the people that follow those rules very tightly, things turn out okay. But often, and really often, it's not pleasant for the child. They have amnesia as part of the drugs most of the time, but not all of the time. And we can do better. And we've been doing better, which is why it's frustrating that this is still happening so commonly in our country, to the point that children are still dying every year. We have other solutions that we have brought forward that have been introduced in the clinical practice guidelines for our field, that these are the standard of care as stated by our membership organization, the American Dental Association, that you can do a stainless steel crown without drilling a tooth or giving an injection. You can just put it over the tooth with the Hall technique, that you can use silver diamine fluoride to stop or slow cavities, that we have all of these techniques, the smart fillings, so that we can not have to put children through so much. So our heart goes out to the community and the family, and honestly, even the pediatric dentist who just lost her license and I believe is in jail. Please help get the word out that there are better solutions that are more humane, that we have created as a comprehensive set as minimally invasive dentistry, certainly for the treatment of baby teeth. And that we're on this frontier now of expanding that to all ages care. So please help us get the word out that there are better solutions that do not risk the lives of young children to treat the most common disease in children, which are cavities, and minimally invasive dental solutions for them.